Hey everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy the show.
Everybody, I'm Dr. Nick Circolone. I'm so excited to be here as always. And again, thank you for tuning into our show. Today, we're going to be talking about golf. Now, what we're going to be talking about specifically today is how to improve performance. Say, how can we improve performance? Are you going to teach us a new swing? Are you going to teach us a new stance? Are you going to tell us about a club? No. What we're going to talk about is how to improve your function so that when you do use a new club, if you take on a new stance, if you learn how to swing at the ball, these are going to be better because we're going to improve your function. Now, towards the end, we're going to give you 2 simple exercises to do to help improve your performance. Now, I know what you're thinking. You're going, Doc, I've been playing golf for years and years and years, and I play a pretty good game. But how can you improve my performance? Well, let me tell you, most people that play golf have a great form, they have a great set of clubs, and they use the best balls. But what they don't do is they don't increase their performance by changing the way they function. And that's where we're going to come in. We're going to talk a little bit about chiropractic. And of course, we're going to be talking about just the biomechanics of the body and how it functions when you're playing golf. Some of these principles will and do spill over into other sports, such as basketball, football, baseball, hockey. Anything where someone needs to increase their performance, they can do it through some of the things we're going to talk about today. But today is going to be golf. So let's get started with the first thing. The first thing you want to do is you want to improve your foundation. Improving your foundation is really hard to do. Now, a lot of guys will buy specific shoes, and a lot of women, of course, will buy specific shoes to help with their balance or their foundation. That's great, but if you don't know what your foundation looks like, you don't know how to improve it. So one of the things that we'll talk about is maybe having your feet scanned to see how you stand barefoot, and then seeing if an orthotic will improve that. The other thing is how does your body move in time and space? So when you're making that swing, are your hips rotating too far? Are they rotating too slow or not far enough? These can all be corrected through manipulative therapy. Now you're going to say, well, okay, I know that you're a chiropractic orthopedist, your function is going to be coming from getting adjusted. That's true, but think about this. Most professionals, we're talking baseball players, football players, hockey players, golfers, they all have one thing in common. They use chiropractic services to improve the function of their spine, of their pelvis, and other joints. So don't poo-poo the idea of getting chiropractic manipulation to improve performance, because it does. And I had a gentleman this week, and that's why we're talking about this. I told him he was having tremendous amounts of back pain, an avid golfer, and when we were talking about how to improve in his overall low back pain, manipulation, of course, is one of those things. And then he says, I want to go play some golf. Can I go play golf? And I said, yes, but be prepared. Your golf game is not going to be as good as it was prior to me working on you. And he's like, are you kidding me? I said, no, but once your body realizes where it is in time and space, with the new alignments, you are going to improve tremendously. He said, okay. So he goes and plays golf, comes back and says, Doc, that was the worst game I've ever played. But I played 2 days later, and I played the best game of my life. That is not just a once-in-a-lifetime kind of thing. It happens so frequent that I wanted to talk about it today. So don't think that chiropractic can't help your game, because it can. The other thing is core. If your core is not strong enough, if your core doesn't engage when you're making a swing, what you're doing is you're using a lot of energy to hit that ball. If you've ever seen a professional golfer, when they hit that ball, it's very effortless. It's very smooth. It's very easy. Well, that's where you want to get your game to be, is that smooth and easy. And like I said, a lot of these guys are using chiropractic care to help improve their overall function of their bodies. So what do we do about it? How can we fix it? How can we improve it? Well, number one, we're going to find a chiropractor in your area that deals with sports. Not just any chiropractor, but a chiropractor that understands sports. Now, myself, if you have a little bit about me, but I've worked with Olympic athletes all the way down to senior pro golfers. So in my wheelhouse, I know how these sports teams and these sports actually work and what's required for them to perform at their optimum. You may not be in my area. Find someone in your area that can do the things that I do that specifically work with athletes. Again, some of you are thinking, and I always thought, golf is really not a sport. If an 80-year-old man can beat me, it's a game. That's not quite true. It is a sport. It's very intense. A lot of people that play golf understand it's a very mental game. It drives them crazy because they're competing against themselves more so than they're competing against other people. So it is one of those sports where it requires not only mental but physical ability to play the sport. Now, when you're 80 years old and can walk on a golf course, play and hit 18 holes, that's amazing. But we can improve that just by doing a few things. One of them, as I said, was chiropractic care. The other one is orthotics. And then the third and final one are two exercises that I really, really like to help develop the core. The first one is for dysfunctional breathing. A lot of us breathe from our chest. We get all of that in there just by lifting our chest muscles. Well, we're using too much of our chest to open up those lungs. What we need to do is we need to pull down on that diaphragm to expand those lungs, not to pull them open. So the way to do that is to place your hand on your belly, and we've talked about this before. Hand on your chest, breathe in, and your belly will extend out. It'll give you that kind of beer belly look. This is great for women and men. It doesn't matter. And let it out. In through your nose, out through your mouth. And somebody asked me, how many times a day should I do that? You should be doing it all the time. You want to practice so that belly breathing is second nature. It happens automatically. When that occurs, you're able to play in any sport with that kind of abdominal breathing, which is not only going to increase your performance, but it will increase your inflow of air, which will give you more oxygen and increase that oxygenation to your blood, giving you more energy and allowing you to play longer. The second one that I like is called the Kegel exercise. Now, a lot of women know exactly what a Kegel exercise is, but for you men that have never done it before, it's basically, the easiest way to describe it is, as you're urinating, you're stopping it. Those are using pelvic floor muscles. As you're using those pelvic floor muscles, they get stronger, they get tighter. Not only are they going to help improve your bladder and other areas in that pelvic floor, but it's also going to help with your core. So remember, if you're standing in front of a mirror and you're thinking about stopping a urination, you're squeezing your butt cheeks together, you're squeezing those floor muscles together, and you're holding it for about 10 seconds and releasing it. And you want to do those at least 10 times, 3 times a day. Again, the dysfunctional breathing, you're going to be trying to do that where it becomes innate, it becomes automatic. And the Kegel exercises, well, you're going to have to learn how to do those. And again, it's just basically bearing down and tightening up those muscles, holding them for 10 seconds, and doing it about 10 times, 3 times a day. And I guarantee if you do those 2 exercises, think about the foundation, and also get regular chiropractic care by a sports chiropractor, you'll feel tons better, and I guarantee you will increase your performance. So if you like the show, please subscribe to us, leave a comment, and let me know how you're doing with your performance after doing some of the things that we've talked about today. So have a great week. We love you. and God bless.